Alright, ladies and gentlemen, how are we doing? Welcome back to the IELTS Daddy. So right now we are going to look at the integumentary system, a client with burns. Let's get started. The client diagnosed with a partial thickness burn is prescribed methadone acetate. Which intervention should the emergency or ED nurse implement when applying this medication? Number 1, do not administer if the serum sodium level is decreased. Number 2, assess the client's urine for any increased concentration. Number 3, determine the amount of burned skin using the rule of 9. Or number 4, pre-medicate the client prior to administering the medication. What do you guys think is the answer? Alright, first off, methadone acetate is just something applied, a drug applied topically on the skin. So what do you expect? Which intervention should the nurse implement? If I'm so fast, kindly pause and then look through the options. Otherwise, the best answer was number 4, pre-medicate the client, because this antimicrobial drug is very extremely painful. You want to make the patient comfortable. Let's look at the other options. Don't administer if serum sodium. It does nothing to do with sodium serum level. Number 2, assess the client's urine, nothing to do with urine. However, in burns, yes, the client would have lost a lot of water, but it's nothing connected to this drug. Number 3, determine the amount of burned skin. Again, you would have determined the amount of burned skin even before the doctor prescribes this drug. So the answer for number 4 was the answer. Number 2, the nurse is discussing the application of silver nitrate to client diagnosed with a partial thickness burn to the left leg. Which information should the nurse teach the client when discussing how to apply this made after discharge? Number 1, administer the silver nitrate ointment directly to the burned area twice a day. 2, notify the HCP if a black discoloration occurs on the burned area. Number 3, apply the silver nitrate solution to the wound dressing every 2 hours. Or do not allow anyone except the HCP to change the wound dressing. What do you guys think is the answer? Alright, the answer is number 3. Apply this silver nitrate solution to the dressing every 2 hours. Yes, this is how we actually do it. And yes, you apply silver nitrate every 2 hours. However, anyone can change the dressing provided they are trained by the nurse. So the dressing is changed about 12 hours every 12 hours. And moreover, silver nitrate causes a black discoloration, so there's nothing to worry about that. Alright, let's go through the options. Number 1, administer silver nitrate ointment directly to the burn area twice a day. No, it's applied every 2 hours. Number 2, notify the HCP if a black discoloration occurs in the burn area. No, black discoloration is the color of the silver nitrate. That's how silver nitrate shows up on the gauze on the skin. Number 4, don't allow anyone except the HCP to change. Anyone can change the dressings, just the role of the nurse to train the caretakers. So number 3 is the answer. Number 3, the client diagnosed with a full thickness burn over 38% of the body is admitted to the burn unit for hours after the fire. The HCP writes an order for Ringer's lactate 450 ml per hour. Which interventions should the nurse implement? Select all that apply. How do you select all that apply? By either true or false. Number 1, question the HCP orders. The question is saying full thickness burn over 38%, admitted Diane 4 years ago. Doctor says HCP 450. No, there's no need to question this order. In as much as you see this speed is too much, but remember this is the resuscitation phase. Any speed works, provided you can give this fluid, resuscitate these fluids to the client. It's all okay. So throw that out. Number 2, administer the IV fluid as prescribed. Absolutely yes, 450 is okay. Number 3, infuse the IV fluid via pump. Of course, you gotta use a pump so that you can resuscitate much faster. Number 4, do not administer more than 200 ml per an hour. No, you're supposed to administer as much as you can. So the answer was number 3 and 4. Number 4, the client experienced an electrical burn that resulted in full thickness burns to the right and left hand. The HCP ordered the fluid resuscitation rates, which data indicates the fluid resuscitation is effective. So number 1, the client's urine output is less than 30 ml per hour. Number 2, the client's urine output is at least 50 ml per hour. Number 3, the client's urine output is 75 to 100 per ml per hour. The client's urine output is greater than 200 ml per hour. What do you guys think is the answer? Alright, the normal urine output is 30 ml per hour. Let's go through the options. HCP ordered fluid resuscitation rates to this patient who had a full thickness burns. Which one indicates that resuscitation is effective? Keyword is resuscitation. The normal urine output is 30 ml per hour with no resuscitation. That means number 1 is off. Less than 30 ml, no. At least 50, that would be fine. However, when you look at option 3, 75 to 100, that carries more weight than the number 2. So number 3 is the answer. Again, urine output of 200 ml per hour, that's ridiculous. That doesn't even exist. Are you using some diuretics, some strong diuretics, or what? Number 5, the client is admitted to the ED diagnosed with a partial and full thickness burn to the left leg. Which question is the most important for the nurse to ask the client? Number 1, when was your last tetanus shot? Number 2, can you tell me how this burn happened? Number 3, will you need any help when you go home? Number 4, have you taken any antibiotics in last week? Which one is the most important? Which one is priority? Which one will save the life of the patient? What do you guys think? Alright, the answer is number 1. When was your last tetanus shot? Oh my god, tetanus is extremely dangerous. We want to avoid or prevent the Clostridium tetani from getting into these open wounds caused by the full thickness burn. So number 2, can you tell me how this happened? Oh my god, avoid this question. This is not time for assessing such questions which are not gonna save the life of the patient. Number 3, will you need help when you go home? Those are discharge questions, not priority right now. Have you taken any antibiotics in the last week? No need right now. Alright. Number 6, the client diagnosed with a partial thickness burn to the entire right leg who is being treated with silver sulfadiazine develops leukopenia. Which med should the nurse expect HCP to prescribe? Number 1, discontinue the silver sulfadiazine ointment immediately. 2, continue administering the silver sulfadiazine ointment. Number 3, administer aminoglycoside antibiotics intravenously. Number 4, administer a hydrocortisone cream to the burn area. What do you guys think? Alright, the answer is number 2. Continue giving this silver sulfadiazine. First off, when you give sulfadiazine to this patient and then they develop leukopenia, this is expected. It's just temporal. With time, it will subside and the WBCs will get back to their normal levels. Alright, number 7, which client should the nurse use caution when applying methadone acetate to burn area? A client with creatinine level of 0.8. Number 2, a client diagnosed with COPD. Number 3, a client with pulse of 95%, or a client diagnosed with type 2 diabetes who is taking insulin. What do you guys think is the answer? Alright, a client diagnosed with COPD. Yes, that's what we actually would that's when you use caution when you apply methadone acetate to a burn area. First of all, this methadone acetate, what does it cause? It causes acid-base imbalance in the body. How? By causing excretion of bicarbonate. So whenever they cause excretion of bicarbonate, what will they do to the lungs? The lungs will notice that there is metabolic alkalosis in the body. So what they will do, metabolic acidosis in the body. So they will try to work so hard by retaining most of those hydrogen ions, so that most of those by breathing so hard, so that they can blow off that carbon dioxide which has hydrogen ions. And remember, in this condition we have COPD, so meaning you're causing serious issues. The patient will still stay in an acidotic state, because remember, there was massive excretion of bicarbonate by the methadone acetate. Yes. So in this scenario, number 2 would be the answer. Number 1, this is a normal level. Number 3, normal pulse level. Number 4, this is expected. Of course, someone in diabetes is supposed to take insulin. Methadone acetate has nothing to do with that. Alright, number 8, the client diagnosed with partial fullness burns to 38% of the body is admitted to the burn unit. The HCP has prescribed famotidine. Which statement best describe the rationale for administering this med? Famotidine is a what? Is an H2 blocker. Let's go ahead. Famotidine acts on the cell wall to prevent bacterial growth. Number 2, famotidine will help control the client's pain. Number 3, famotidine will decrease the client's nausea and vomiting. Or number 4, famotidine will help decrease gastric acid production. What do you guys think is the answer? You can always pause if I'm so fast, so that you can internalize the question. Alright, definitely this was straightforward. If you know the mode of action of these drugs, number 4 was the answer. This is what famotidine does: decrease gastric acid production. Alright, by blocking histamine 2 receptors. Alright. Number 9, the HCP prescribed morphine 2 to 5 mg IM every 2 hours for the client diagnosed with full thickness burns to the chest and abdominal wall. The client reports pain of 10 on a 1 to 10. That means it's so painful. Which intervention should the nurse implement? Administer 5 mg of morphine IM to the client immediately. To contact the HCP to request an increase in the med. Number 3, request a patient-controlled anesthesia pump for the client. Number 4, assess the client for complications and then administer the med. What do you guys think? Alright, the answer is number 3. First of all, when it comes to the NCLEX, always put the patient first. This patient is feeling a pain of 10, full thickness burns. Why not just give them a patient called anesthesia, whereby they will just have to increase the dose on their own without your intervention? Alright, that was the best answer. Number 10, the client is prescribed silver sulfadides for a partial thickness burn to the back. Which information should the nurse discuss concerning this med? Number 1, encourage the client to drink 3 liters of water. And number 2, discourage the need to eat foods high in protein. Number 3, teach the client how to test the urine for ketones. Number 4, instruct the client to change the dressing twice a day. What do you guys think is the answer? Alright, and the best answer right here, regarding this med, is number 1, encourage the client to drink 3 liters of water. Absolutely, yes, this was the best answer.